Okay, so I joined this collaborative because I'm a consultant clinical psychologist, clinically leading a Bradford cancer service. And for me, it's really important to try and understand how we can move people through our service in an efficient way, how we can respond to people more quickly when they've got mental health difficulties. We've got huge waits at the moment. We've got a real high demand on our service. We're getting multiple referrals, and referral rates are increasing month on month. And we really need to be much more efficient at how we help people through that and how we respond to them and ensure that they get the right care at the right times. This feels like a really good way of trying to understand what's happening right across the country and right across services, and a really good opportunity to bring all those ideas together. So I think I'm looking for ideas from the collaborative, ideas from working with people who are involved in different services across the country. I think I'm looking to make sense of the strategies that we've already implemented and why we've put those in place, trying to understand a little bit more around how we might front load assessment and put more expertise at the front door, but then also thinking about how we move people to a place where they no longer need our service, so they're in a place of recovery or they can be stepped down to a different type of care. And just really interested to bring together the ideas of everybody working across the country and across services in delivering mental health care. So I think the exercise that we carried out, which was kind of moving people through, it was a very visual, very practical exercise. And what I would take from that is that there's something about the flow that is almost equally or more important than the capacity and the demand issues. So it made me think about kind of sort of managed speed limits on the M25 and how you kind of might reduce the speed limit, but actually it means that people get to where they need to be quicker and they move through. And it felt quite containing and quite a consistent approach to kind of have people moving at a steady pace through. And I think that would be really satisfying for our families as well. I think they'd have a better experience and I think they'd be able to understand the processes better. So for me, it's trying to take my thinking more in terms of flow than all the time thinking about who's waiting and how do we get them into the service or how do we get them out. Actually, the kind of the bit in the middle, really.